Tourism Minister and Bali Governor looking at stricter measures for naughty foreigners. And Indonesian National Health Insurance explained apparently there's been some misunderstandings, including from me, about what's coming up next year. Stay tuned for details on these stories and more. Welcome to the latest news from Bali and Indonesia. This is June 16th, 2024, and my name is Bruce. And what is the weather like today? It is glorious. Wow, 30.3 degrees Celsius, 70% humidity up here in Singaraja, and the wind speed is a very breezy 24.3 kilometers per hour, and it is absolutely lovely, sunny day, and windy, which makes it feel cooler than 30.3. And so the last few videos have been focused on bules behaving badly. And of course, there was going to be some reaction from the government with all these viral videos. And last night I was looking at Instagram, and there are even more of some foreigners punching each other out. Not Indonesians this time being punched out, but foreigners punching each other out in front of some bar in Canggu, and more yabos doing wheelies and burning rubber in circles and blocking up traffic, and more of the usual stuff. So Pak Sandiaga is saying we're going to get tougher, and the governor of Bali, the acting governor of Bali, says we need to get tougher. And so let's take a look and see what they've got to say about that. Providing a deterrent effect for foreigners from acting up in Bali, the Minister of Tourism says that just deportation is not enough. Pak Sandiaga has responded to a number of foreigners acting up in Bali while on holiday. According to him, foreigners who act up must be given legal sanctions and a deterrent effect. If necessary, he said, not only deported, but prohibited from visiting Indonesian destinations. Well, if they're deported, they're going to be prohibited, I guess. Not only Bali, but other destinations if they often violate the law. Sandiaga explained that in 2023, there would be 11.7 million foreign tourist visits, especially during cold weather in Europe. Of these 11 million, only 340 people were deported. According to him, this number is very small compared to the number of tourists who visit. He also said that all parties must ensure that Bali and others are destinations that must comply with the rules and follow Indonesian customs. Almost every day in Bali, he said, 20,000 tourists arrive. Therefore, it's important to increase monitoring and enforcement of legal violations. Moreover, he said, if you look at the last few months, the number of foreigners acting up in Bali has increased. Sandiaga said this requires support from not only law enforcement officials, but also the community and the entire tourism ecosystem in order to continue foreigners to behave themselves while they're here. Now, here's an interesting thing that he had to say. There are limits for tourists when they drink alcohol. The use of drugs is prohibited, and you'll be dealt with very severely if you do drugs. Any alcohol that can trigger unlawful behavior must be limited and monitored. Yes, if they lose consciousness due to excessive alcohol consumption, they can carry out activities that violate the law and norms. Some, he said, have even taken their clothes off, and so on. Yeah, I saw a video about that last night, too, of a guy on a card without his pants on. Maybe in his country, he doesn't act like that, Pak Sandiaga said. Tour guides and accommodation providers also have a duty to remind tourists. Tourism actors were asked by Pak Sandiaga to inform their tourists that in Indonesia there are restrictions. When foreign tourists buy alcohol and exceed their tolerance, the waiter or bartender should say, no, you've had enough, too much. And they can't just go home. They have to be accompanied, and they can't drive a vehicle. They are not allowed to drink while driving. They must be accompanied so that they do not commit acts against the law. So, Pak Sandiaga is saying that the bartenders and the waiters should be responsible for monitoring tourist behavior. Now, you've got places like that. In a different article where he talked more about this, he said there are a lot of countries that do this, that limit the amount of alcohol you can drink if you're drunk. They can refuse to serve you. They can ask to have your keys, call a taxi for you. Well, he's saying that that's going to be, or it should be, the responsibility of bartenders and waiters. Now, the question is, do you want to be a bartender and tell some drunk tourist, maybe some drunk tourist who's way bigger than you are, sorry, had enough, mate, no more alcohol for you. By the way, give me keys to your motorcycle or your car because you're not driving. And how is that going to work out? So will this recommendation, suggestion from Pak Sandiaga, is this going to carry any weight with people in the tourist industry? Personally, I don't think so. But I guess we'll just have to wait and see. What do you think? Previously, the Immigration Office collaborated with related agencies to issue regulations on the do's and don'ts while on holiday as a form of education. The rules included 12 things you can do and 8 things you cannot do. And we talked about that a lot when that came out. And, well, it didn't seem to be socialized very well. Pak Sandiaga said the behavior of foreign tourists violating the law doesn't only occur in Bali and other places in Indonesia, but is also experienced by other tourist destinations in several countries around the world, one of which he noted was Barcelona, Spain. And if you do follow tourist news around the world, which I do, you'll see this going on in Rome, in Venice, in Japan, in Korea. I haven't seen anything about this in Singapore or Vietnam. Some problems definitely in Thailand. So he's right about that. And also, if you take a look at the numbers, the number of people being deported, and I think up here in Bulawayo, it's a relatively small number, but it gets put on social media and it's all over. And what he is saying, and I talked about this in the last video, is don't make it viral because it looks like Bali is a lawless area and people are just going berserk here. Some people are, but the overwhelming majority of tourists are not going crazy. Now, there's been some calls to limit the number of tourists coming into the country or to make it more difficult for people to come in by doing away with the VOA, for example, completely, or raising it significantly higher. I've heard as much as $500, which is, well, pretty outrageous. I think that would end our problems with tourists who are behaving badly, because we wouldn't have any tourists if they had to pay $500 to come to Bali. Pak Sandiaga says, of course, the way to do this is not to limit visits, but to implement a policy that will naturally ensure that tourists in Bali or Indonesia stay longer. I'm not sure how staying longer is going to make them behave better. Apart from staying longer, he continued, tourists are also expected to have an economic impact on micro, small, and medium enterprises, as well as local creative economy players like the Icon Mall in Sanur, for example, or the big beach clubs in Canggu. And he said they should respect customs and culture, preserve nature, and promote responsible behavior. For this reason, he invited all parties, not only the government, but also law enforcement officials and industry players, to provide education and prevent violations. He gave, for an example, the incident that occurred when the tourist from England stole a truck and broke into Nurai Airport Terminal, causing damage. Pak Sandiaga said the foreigner was under the influence of alcohol, so he acted out of control. Now, I saw a video with him, I guess taken by the police, and they were asking him, were you drunk when you did this? And he said, no, I wasn't drunk. I only had 3 beers all day. He said, but I had this feeling that I needed to get out of the country right away. I needed to get to the airport. I got kind of paranoid. And he said, I tried to take a taxi, but taxis wouldn't stop for me. He said, maybe because of the way I was dressed, sweaty and disheveled. And the police asked again, you sure you weren't drunk? And he said, no, I wasn't drunk. I wasn't drunk. So that's the latest update on that one. Anyway, Pak Sandiaga says prevention that should be done is by reporting to the police or traditional security officers at Pechalang and Tourism Satpol PP. Pak Sandiaga, back on alcohol again, said many of these law-breaking behaviors are triggered by drunk tourists. If he's drunk, he doesn't know what he's doing. He said tourism actors should have a code of conduct. The Ministry of Tourism and Creative Economy targets that in 2024, as many as 14.3 million foreign tourists will visit Indonesia, an increase compared to 2023, which was 11.68. Pak Sandiaga said he hopes that foreign tourists visiting Indonesia will have quality and will also be supported by a tourism sector that applies sustainable concepts. So, still a call for quality tourists. I don't know how you're going to force tourists to be quality, but as I've said before, Pak Sandiaga and other players in the tourism industry here in Indonesia are equating quality with more people who stay longer, who spend more money, and it's hoped that they'll behave well. Okay, so now let's see what the governor has to say. Pak Sandiaga says, stop serving people alcohol if they're drunk. They've got to be deported, but there has to be penalties. And so what has the acting governor got to say? Foreigners often act out in Bali. Provincial government plans to form an integrated team for development, supervision, and guidance. The acting governor of Bali responded to incidents involving foreign tourists in Bali, where the latest incident is where a foreigner blocked and slapped the helmet of a motorbike rider. The governor said that regarding behavior of foreigners acting up, he's emphasized that his party has asked for firm action from the authorities. Yes, he said, we have asked the regional police and immigration to take firm action, said this yesterday. The step was taken to ensure the safety and comfort of the Balinese people and visiting tourists as well. Furthermore, the acting governor explained that efforts had been made by the Bali provincial government, Pemprov, to deal with deviant behavior from foreign tourists. I am clear like this. We have formed a Tourism Satpol PP whose duties include providing assistance and providing information to foreigners on what they can and cannot do. The acting governor said there's going to be another one, an integrated team for supervision and development. The team is expected to be able to supervise and provide guidance more effectively to prevent deviant behavior from foreign tourists in the future. I wonder how that's going to happen. So the authorities are riled up about this. They don't like this stuff going viral, getting out into the press. So word that tourists are doing some outrageous things here. This truck incident, I think, got a lot of press. You don't get tourists usually stealing trucks and driving around crazy. So they said things are going to get tougher. Are they? I don't know. Going to put a limit on alcohol, but let's keep building more and more beach clubs that do what? Serve alcohol. Okay, BPJS, the Indonesian National Health Insurance. Let's talk about that because it was, a month or so ago, I was talking about how they were going to go to one standard. That was what was being reported. One standard from the three that are currently used now. Well, there was a lot of criticism about that when that came out. People who said, no, what about those of us that are paying premium? Why are we going to have to be in rooms with 10, 15 people, whatever the government said they were going to make it down to 4? But there was a lot of criticisms of this going to one standard. And so what does the boss of BPJS have to say? BPS Kesehatan CEO, inpatient classes will not be scrapped. Kesehatan CEO Ali Gufran Mukti explained that standard inpatient class system stipulated in the presidential regulation on health insurance is not going to be changed from what it is now. According to him, BPJS is often the target of harassment, mostly due to misinformation regarding its services. He said he's certain that the public does not fully understand the information, including the information regarding the standard inpatient class, which is called CRIS. This is a system stipulated by the presidential decree that just mentioned. The government, Pak Gufran said, has no plan to implement a single class system or eliminate the inpatient ward class system. There's not a single word, he said, whatsoever in the regulation that says the ward class system will be abolished. He explained that the CRIS system was formulated as a standardization guide to regulate medical services such as building quality, room temperature, number of beds, etc. He also discussed the uproar in social media over a veteran musician who lamented a long queue for the BPJS services in Banten. However, BPJS Kesehatan ambassadors, which is what he calls the employees for BPJS, explained to the singer that he could wait at home. There are a lot of false perceptions, said the former deputy health minister. And if you follow this channel, you know that I use BPJS, and the way that I do this is I go through BPJS to get my initial screening, and I use the app for that, and it comes with a number that shows what number you are, and so you can figure out when you should come. Now, I'm usually number 1. There's not many people that go to the doctor that I do here to get the initial screening. So I know I'm number 1, so I can go there at 5 o'clock when he opens, and I'm going to get treated right away. Now, when I get my recommendation, my referral to the hospital, I use the hospital app, and I register there, and I get a number again and a estimated time when I'm going to be treated. So for example, if I'm 24 and the doctor comes at, say, 8 o'clock, well, he actually shows up around 9, but let's say 24, and they say you can look at being treated around 11 o'clock, I don't go to the hospital until 10 o'clock because you're supposed to be there 45 minutes in advance of when you're expected to be treated. So that has worked very well for me. Now, I don't know about other hospitals, so that's the way I look at this waiting thing. It's gotten easier with the apps and when you can see when you are probably going to be treated. Pak Gufran elucidated innovations he created to counter the hoax on BPJS. For example, he wrote a song titled Bloom Tau, or Uninformed, and he sang it with Gajah Mada University rector Ova Emilia. A song expert, I don't know the music. I know you don't know yet that BPJS is very advanced. Many countries want to copy it with its quality cost control. Not only did he compose songs, but the doctor also wrote a book titled Rosotello Dadi Duran, Bien Gelo Saki Kren. Cassava now tastes like durian, from feeling disappointed to feeling cool. The book chronicles BPJS's 10-year journey over the past decade. He said that the book is a comeback to mockery by some doctors who said that BPJS is disappointing. He said, our task is to raise awareness and build perceptions. So we have a singing CEO of BPJS. This is too good to be true. He also explained the controversy surrounding healthcare insurance standardization. He expounded on his agency's recipe for successfully improving the once unbalanced balance sheet that recorded deficits before the COVID-19 pandemic. He said the presidential regulation says nothing about eliminating inpatient classes. I have no idea where that information originates. It regulates that members who are recipients of premium subsidies or who cannot afford to pay premiums are not eligible to upgrade to the VIP class. Sometimes people have the money but only pay Class 3 premiums, but when they get sick, they want to use the VIP class facilities. That is ridiculous. He was asked if there was a guarantee that there's not going to go to a single class. He said, I don't know where the term came from. There's no mention of this, as I've said. Again, during his interview, it was brought up that the public perception is that the single class system will be implemented. He said someone did mention it, but it's not about scrapping classes. That's why I created Bloom Tau. And there's another song titled Content Viral content that comes from the BPJS experience. I love it, the singing CEO. He was asked what experience. He said there was a hospital involved in a fraud case. Essentially, they engaged in a practice that benefited them, but violated regulations. We ended our partnership with them. The owner of the hospital freaked out. They were disappointed, contacted the health ministry and the House of Representatives. We suspect that they also contacted a content creator who shared a viral post in which BPJS was accused of arbitrarily terminating the partnership, leaving his father in a life-threatening situation. How did the creator know that the partnership was gone? Somebody must have told them. We contacted this person and said that their message was not true. The content creator eventually acknowledged it and made a remedial post, but what went viral was the first one. That's why I wrote the song, he said. He was asked, what's the meaning of standard in the presidential regulation? He said, what needs to be understood is not that it's about standard classes, but standardization of hospital wards. So far, there hasn't been medical and non-medical service standard. The meaning of standard in the presidential regulation is established through 12 criteria, namely ventilation, light, building components, room temperature, bathrooms, and hospital bed density, among others. That is the healthcare standardization the regulation seeks to govern. He was asked, what's the background? He said, I'll give you an example. I was a hospital in South Tangerang that did not implement a class system. I asked what their aim was. They said it was to avoid discrimination. As a result, most of their patients are from underprivileged communities. Meanwhile, well-to-do patients definitely go to hospitals that apply the class system. So the purpose was not to differentiate, but it clearly differentiates. He said the CRIS system is about improving quality, but I don't want to improve only quality. Access to services must also improve. We should not allow a situation where quality increases but access decreases. In the past, there was an adage that said, the poor are forbidden to fall sick. I want to change that to the poor are forbidden to pay when they fall sick, as long as they are active participants in BPJS. So, for people that were worried about going into the one standard, looks like it ain't going to happen, at least according to BPJS CEO. Okay, that is it for today. Thanks for viewing. Be kind to someone today. Stay safe, and see you next time.